Hello everyone. Our topic for today is someone with a headache and a fever, fever and a headache and a fever, with altered mental status, headache and a fever, altered mental status. So what do you think your differential would be?
Herpes encephalopathy.
Yeah, what else?
It could be any infection, meningitis. It could be an abscess, any kind of any sepsis.
Perfect, yeah, it could be an abscess, sepsis, encephalitis, meningitis. So meningitis, we do head CT, lumbar puncture, CSF analysis, HSV, okay? And we test for the CSF, we test for bacterial, we test for viral, we test for fungal, okay? We discussed the bacterial fungal today. Here's the viral, okay? So what are the things that make you suspect it's a viral meningitis?
Actually, it's very hard to figure that out from the clinical appearance, but the patient usually presented with altered mental status like confusion and fever. But then we have to exclude it by doing like a CSF analysis.
Okay, so three things. Number one is that febrile encephalitis with focal neurologic deficit. This is number one. And altered mental status, as you said. Perfect. Confusion. While bacterial usually with neck stiffness. And the second one is that CSF analysis shows lymphocytic paleocytosis and elevated protein, elevated red blood cells, but normal glucose. Viruses don't eat glucose, okay? They're the only ones that are on a diet, that they don't like sugar. Okay? Well, bacteria and fungal, they love sugar. So that's why they eat sugar, that's why you have low glucose. Okay, so this is the second one. Third one is temporal lobe abnormalities on CT and MRI.
Yeah, sure.
Okay, so these are the things. So what diagnostic testing would you do?
Usually we start with the CSF. And then we check for a CT scan or MRI for temporal lobe hemorrhage.
Okay, perfect.
With also we try to confirm that with the CSF PCR.
Excellent, yeah. So we do lumbar puncture, CSF analysis, head CT. These are the important ones, and CSF PSR for HSV. Okay, I like this music. And then when do we do brain biopsy?
Brain biopsy usually it's like more theoretical, but usually when there is no other diagnosis.
Excellent.
Besides HSF and
when
PCR is negative.
Yeah, when there's no diagnosis, negative PCR. This is like, yeah, you're right. It's theoretical. So how do you treat it?
We start treated by IV acyclovir. IV acyclovir is the mainstay of treatment. So. And we otherwise like just supportive therapy.
Okay, so it's just like prednisone that we have to give PPI, vitamin D, calcium. Acyclovir we have to give hydration, very important, to avoid renal failure. Okay, so acyclovir, IV acyclovir, and pending the treatment. While you're waiting for the PCR, you just start it. You don't wait for it. Why? Because you want to prevent death. Okay. And patient should be treated for 14 to 21 days. Okay, so let's run over a case. Let's run over the timing. So initially, any suspicion of herpes encephalitis, when you see headache and a fever, altered mental status, you start IV acyclovir empirically, okay? After that, what do?
After we start the acyclovir.
So he's in the emergency room. We do with the acyclovir, you do the police BS mnemonics, which is pulse ox, oxygen, okay, if you need that, intubation if you need it, IV excess, IV fluid, okay. You do CBC, BMP, chest x-ray, UA, blood culture, urine culture, because you look for the infection, source of infection too. PT, PTT, INR, head CT, lumbar puncture, CSF, you just write CSF on the exam and we'll show you, and you click him on the software. After all of that, you do the CSF for PCR for HSV for sure. What do you do after that?
You said that we start IV acyclovir, right?
And you did all of these tests, lumbar puncture, urine culture. So there are three things that when you want to look for infection: lumbar culture, urine culture, blood culture, plus head CT.
Yes.
Okay. So those are three things searching for infection. Okay. After that, you do give him oxygen, like a admission, regular admission criteria. Oxygen, NPO, head elevation, just to decrease the pressure on the brain. Bed rest, IV access. You give him normal saline, IV fluid, hydrate him. And if he is noxious, you give him Phenergan. For fever, give him Tylenol, IV. Okay, so that's about it, just supportive management. And you just continue the acyclovir. Okay? And then after that, you admit him and you wait for the result of CSF. Okay? And you advance the clock to get the PCR results. Once you find positive PCR, you just re-evaluate the patient. You did your job, that means you did a great job. And you just follow up like every day. This is how I would like to do it usually. I just click advance and queue 1 day. That's what I would do. And the software is gonna shift me every day and start following up with the patient. Every day you go do physical exam again, history again, okay, and so on. It should be very simple and easy. And usually the case ends. I did the exam and usually it ends like this. Once you so you start pulse ox, you do the Cutagleam, PT, blood culture, urine culture, you put NPO, head rest, bed rest, head elevation, bed rest, and acyclovir, and after that the case ends usually.
Wow.
Yeah. Okay.
That's nice.
It ends like this, and the software is very slow actually. A lot of things that you don't have time to do a lot of things. That's the thing too. Okay, but it's good. That's why it's good to train on the software that they have, the trial. They give you trial software. You try. Okay, so this is the HSV encephalitis.
Yeah, thank you so much.
Oh, okay, you're welcome. We'll see you on the next one.